All right. Good afternoon. Today is September 30th, Friday, our regular event. We are going to make a little bit change on our regular flow. Thank you for joining us. And again, this is United Medical ACO. My name is Kemal Erkan. I'm the chairman of the ACO. We are going to actually have a new presentation for Medicare Advantage plans for, this is for Medicare Advantage plan for the state of Delaware retirees. So we are going to have Highmark joining us. So let me actually bring Kevin O'Hara in. All right, Kevin, I made you the co-host again. So how are you doing?
I'm fine, thank you.
So we are live right now. So Kevin, today we are going to talk about the new product, relatively new product from Highmark, Delaware. So it's called Freedom Blue PPO. This is for Medicare Advantage. It's a Medicare Advantage plan.
Correct.
And mainly it's for, right now, actually, one big change is, the new big change is, it's for the state of Delaware retirees, which is going to make a big impact as of January 1.
Correct.
So I thought it would be good to have this conversation with you and understand what the plan is going to do. And Highmark has been really great with our other programs, other plans that we have. And I know that it's going to be another a great option for our patients and for the Delawareans. So if you can maybe start with introducing yourself and your role at Highmark.
Sure. My name is Kevin O'Hara. I am the Director of Provider Relations for Highmark, Delaware. I manage a group of field-facing folks who work directly with our providers. I'm not in account management or sales. My job is dedicated to work with providers directly. So that I interact with Kemal and his team on a regular basis, as they are one of our larger providers in the state of Delaware. Do you want me to start sharing my screen, Kemal?
Yes, actually, we can go ahead and do that.
Okay, let me get this to where I want it to be. Can you see my screen?
Yes, we are good.
Okay, so Highmark, Delaware, Provider Relations, Commercial Business. I just put this up here so folks know who I am. And this just at the onset, this is more of a provider-facing deck, but I think there's information that anybody could probably use and would be relevant to just about anybody. But my agenda today is to explain what Medicare Advantage itself is, to talk about the state of Delaware launch, talk about the state of Delaware benefits very generally, the role of the PCP and specialist referrals in the program, continuity of care for the incoming members, our prior authorization requirements, and our Medicare risk adjustment program. So for those of you that don't know, Medicare Part C, or Medicare Advantage, is also known as Medicare Part C. A number of years ago, Congress passed a law and enacted CMS to begin this program whereby Medicare members can opt into a Part C plan, which is a plan that is with an insurance company that has been reviewed and selected by CMS and approved. And that insurance company administers your Part A and Part B, and oftentimes your Part D benefits. They actually assume the risk of the care from CMS or the Medicare system. So instead of CMS paying the claims, the insurance company pays the claims. But most importantly, the insurance companies are bound to cover everything that Medicare covers, and they are bound by Medicare rules. So we are highly regulated by CMS, and that's for obvious reasons. We're stepping in the shoes of CMS in these programs. They want to make sure that we treat their members as well as they would be treated by the underlying Medicare plan. In full disclosure, Highmark began its Medicare Advantage plan on January 1st, 2022. We currently have about 3,000 Delawareans in the plan. Okay, so to talk about the Medicare Advantage and specific to the state of Delaware retirees, effective January 1st, 2023, the Delaware Medicare Advantage plan will be the sole plan for the state of Delaware retiree population. So that population of about 30,000 lives, largely in a Medigap policy now, and they are transitioning into a Medicare Advantage plan. And I'm going to spend a few slides going over some of the implications of that. And again, they're basically provider focused, but it should be stuff that folks are beginning to understand. It is a statewide PPO plan. All Delaware hospitals are participating with the exception of Nemours. And as you know, Nemours is a pediatric hospital, doesn't do much Medicare business. If we indeed do have a Highmark Medicare Advantage member that is a child and in need of services with Nemours, Nemours has agreed to work with Highmark to get that member access to care. They just didn't go through a full contract with us. We continue to recruit and contract our provider network, but we've done an analysis and targeted our recruitment on specific utilization, past utilization for the state of Delaware retirees. We have 2 years of completed claims from March 2020 through March 2021, where we did an analysis and we stratified and focused our recruitment efforts on those providers that the state of Delaware retiree population currently goes. Right now, we have about 94% of those providers under contract in this plan. And we're basically never going to stop contracting in this plan. We will continue to contract in this plan because this plan requires a separate contract from the commercial plan. So it's going to be an ongoing. So as folks move in or providers move into the state, they'll be offered this plan as a matter of course, just like other providers are offered our commercial plans. So talking for a minute about the benefits to the state of Delaware retirees, they are very different from the benefit platform in our standard Medicare Advantage plan. The state of Delaware has created a richer benefit structure for their retirees than our current Medicare Advantage plan has. And for instance, there are both in and out of network benefits. And all of the care, both in and out of network, has a zero copay and zero coinsurance for all care in the United States. And much of the care that's outside the United States, where copays do apply outside of the United States, is for care that's not emergent or urgent. Okay. It is a national PPO network, so the Blue Card program wraps around this product. So if you are familiar as a provider with the Blue Card program, it works the same way as the commercial plans do. And the home plan would submit the claim to us. We would adjudicate the benefits, and then they would do the pricing and pay the claim. In addition to the standard benefits, the retirees also get access to a concierge team for customer service, access to the Highmark clinical team for care management and help arranging their care. They get the Silver Sneakers fitness program, which right now is about 26 gyms throughout the state of Delaware that they get a membership to, and they get post-discharge meals for free. So if they go into hospital, to lessen their burden when they go home, we provide post-discharge meals. The role of the primary care physician. Primary care physicians are not required under this program. They are certainly included in the network, but we do highly encourage the membership to establish a relationship with a primary care. It is widely understood and certainly credibly backed with a lot of case study that members that have a primary care tend to be healthier than those that try to navigate care on their own. And there are no specialist referrals in this program, much like the rest of our programs. There are, however, prior authorization, which if you're a provider, you know those are two different things. Prior authorization is on a select group of services where we ask that you notify us prior to the service being rendered, and we check medical necessity, and in most cases approve the care. In some cases we ask for more information, and in some cases we deny the care because there's a better course of action. Going a little deeper with prior authorization, as I said, in some cases prior authorization is required. The approval rate for the Medicare Advantage program is currently sitting at 92%, so it's good. Most of the 8% is when a provider is submitting an initial prior authorization and has left out some information that we need. So I wanted to just mention that because you're probably sitting there, and people's reaction to that is, what about the 8%? Well, a lot of it ultimately gets approved because in not all cases the provider submits enough information for us to meet the criteria that we're looking at. The turnaround times for prior authorization are better than the Medicare mandates, at 2 days for expedited cases and 5 days for standard cases. I think Medicare holds us to 14 days for standard, and I think it's 72 hours for expedited cases. So we're well below that, which is a good thing. They're not required for emergency care, which is important to notice, and they are not applicable for outpatient services until May 1st. So we got some concern back from both the network and the membership about the go live that prior authorization members might be confused and providers might not know. There might be confusion on the part of providers. So for outpatient services, we delayed that until May 1st. If care is denied on prior authorization, we follow the Medicare appeal process. That is actually a 5-level appeal process. It may look rather cumbersome, but it is meant for CMS to provide every avenue possible for the claim to be reconsidered or the service to be reconsidered and approved. Our risk adjustment program, this is specifically directed at providers. This is, you probably know that risk adjustment activity occurs with the Medicare Advantage population. This slide, which if anybody wants to reach out to me, I can send the slide to you directly. It shows you how to sign up for the UDC program through our UDC portal. That's where all of the gap analysis will show up at your practice. And then if you confirm a gap in care on a go-forward basis, we pay you the amounts noted on the slide. So it can be a revenue generator for you. We know that this is an administrative drag on your practice, so we make sure we compensate you for it. We do ask that all our providers get engaged with this rather quickly because it has to do with our STARS rating as a plan. It also helps to keep the quality performance good in this population. If you're looking at gaps in care, it means that members are more likely to get the care that they need, and you won't miss anything. This is a copy of the member's card, and as we get closer to go live, we are going to provide you with the prefix for the retiree population, so you know it is only the retiree population that the prior auth is waived for the first 5 months. And people on the front line are going to need to understand that all the other MA membership still requires prior authorization. And the only way for them to identify if it's a Medicare Advantage retiree is by the prefix on the card. So we'll be publishing that, which we don't normally do, but it's the best way for your frontline staff to figure out if a referral or if an authorization is needed or not. Just a little plug for Navinet. Navinet, for those of you that don't know, is our provider portal where much of the transactions between a provider and Highmark can take place, including prior authorization requests. But there's a whole lot of things that you can do on Navinet. You can submit claims. You can look at policy alerts and policy changes, updates to processes, and updates to prior authorization lists. There's just a lot of good information. And if you sign up for e-subscribe, which I think, Kemal, most of your practices do, you will get email alerts when new information is updated or posted. That way it gets pushed out to you and you don't have to go looking for it.
That's great.
Then we have a provider-facing web page or landing page that has, it's called Plan Central, and it has all kinds of announcements on it, and it has all sorts of other abilities over here. Or capabilities, excuse me, couldn't find the word. In the Provider Resource Center, you can access our care management programs, you can access credentialing, you can check on and file claims, you can get to our educational manuals, including our provider manuals. You can get to information about our interplan programs, which is Blue Card. You can see recent and historic newsletters. They go back a couple of years. And then at the bottom, there's just a note reminding you of the Provider Services Team, which is the dedicated team for provider customer service. Then this is just an example of the kind of information that's out on clinical information or educational resources that are out on the Resource Center. And that is all I have today. Kemal, I don't know if you're gonna, if you have any questions or if anybody else has any questions.
Let's stop sharing.
Okay.
All right, so let's put Sean back to the waiting room. All right. All right. So, Kevin, thank you for this really good information. So now this can affect almost 30,000 people in Delaware. The communication with the patients that already is final, right? So all the patients, all the retirees, they already know this is coming to their.
They've certainly been notified. Their enrollment packets have gone out. There have been numerous town hall meetings held throughout the state, at least 2 in every county recently, that have had a good deal of attendance. And beyond that, the account management team held several town hall meetings directly with the retiree population in August.
Thank you. So now, what you mentioned earlier, the primary care's role in the Medicare Advantage plans. So just for those who may be not so familiar, so we call them traditional Medicare. So if the patient does not have any plans, so they are just going with the regular Medicare. So it is a traditional Medicare. So those patients, in my opinion, they, and we are that's part of our ACO, MSSP, we are part of it since 2016. I think one of the issues is in terms of coordination, there's a lack of insurance side of it where we don't have this partnership. So I think these Medicare Advantage plans can be great ways to engage the patients in a better way, because as you know, like in many cases, we do need a better coordination of benefits, better support from the insurance, and nothing against Medicare, of course, but when we deal only with Medicare, there is no other party on the other side. And Highmark and United Medical ACO, our value-based partnership started back in 2016, I believe, 17.
You're correct.
And that included our Medicaid population through health options. It has now, other than the commercial, now we have the Medicare Advantage. So I do believe that I have a lot of good expectations, high expectations from this transition, because prior to this, we did not have a value-based agreement for the state of retirees population. So hopefully with this partnership, with this transition, we'll be able to provide.
Yeah, that is indeed, as you know, Kemal, that is indeed the reason we have those programs with you, is to enhance care and to get you to incentivize you to get closer to the member in general. And your organization has done a great job of adopting that and making the best use of those resources that we provide.
That's and I know that we'll be able to work closely with this population and with your team. Mm-hmm. So from the provider standpoint, I see that Nevinet is going to be, again, our portal for online tools, which actually, honestly, we do love Nevinet, so it's a lot easier than other portals to navigate for us. I mean, it's just maybe we use it a lot.
Yeah, to me, that's the key. If you use it a lot, then you're going to get familiar. So from the United Medical ACO side, so we'll be our providers from north, like the farthest point of Delaware to all the way to the south of Delaware. So we have primary care. We also have our specialists, although they are not part of the value base in this case necessarily, but they are part of our clinical integration, and then they work with us in the same fashion that we do on the primary care setting. And I do see that this prior authorization, with the 92% approval rate, we really shouldn't have any issues because part of this is that we want to make sure that any unnecessary utilization is eliminated even before it happens. So that actually is honestly, in my opinion, it's a good thing. From the patient standpoint, we have received some calls this week, and our patients were extremely happy to hear that we are actually part of this. But we actually were one of the first groups who signed for Freedom Blue PPO. That was back in 2021, right? You are, and it was an important first win for us because you have a considerable amount of scope within your ACO. So, thank you for that, and we'll continue to work closely with you and make sure this population is well taken care of. Of course. Kevin, one last thing for you, and this is more like an information only. So our teams work together, and I think one big opportunity that I see for our patients is understanding the social determinant of health, SDOH. And I think why we are so excited with this is that we are able to utilize our resources in the right way. As you know, we have 2 social workers. And again, I do case conferences with my team, including Donna Gunkel, who's our clinical director. So there are 2 case conferences every day that's happening with almost 15 nurses and 2 social workers. And when we have a partner on the other side, on the insurance side, like your group, I know that our patients are definitely going to get much better care and better understanding of what they are going through. Sometimes I make calls just to see how that interaction is with the patient. And this group, 65 and over, many of them, 75 and over, and they need special handling in terms of how we communicate with them, what they need, who's able to provide them the best care. So I'm really excited that we'll be able to do a lot better, a lot more for our patient population. Yeah. To that end, if there's any information your team needs from me or somebody within Highmark to get that done, you know how to reach out to me. I think we can get you anything you need by way of resource or education. I mentioned some added benefits to this program, and if anybody wants more information so that they can advocate on behalf of the membership for those added benefits, I'm happy to provide it. All right, absolutely. Well, Kevin, thank you so much for joining us, explaining the process and the transition. And anything that's needed from our end, please don't hesitate to just call us and let us know what you need and what our patients may need. We'll be ready for the transition as of January 1, 2023. You know I will. Thanks, Kemal. Have a nice day.
All right, so we're going to let Sean back in. So then we'll start our regular flow. So this was important, what we had with the Highmark Freedom Blue PPO. This group is an important group for us. The way that we work with our Medicare patients, as I was mentioning earlier, it's a different game because they need, I mean, you have to be more sensitive just because they may not have enough help at their home. That's why I was mentioning the SDOH, social determinant of health. Unless we understand exactly what our patients are going through, it's going to be difficult to provide the service that they need at the best level. So we are happy that Highmark is taking this role, and hopefully we'll do a lot more in time. So we have our COVID update. So Sean, we can start with that.
Sure. Yeah, good to be back here. Thanks, Kevin, again for that Highmark presentation we just had. Very informative. And just adding on that, we know that with a transition like such, it's very important to have effective communication to make sure things are clearly understood. So we think that's a beneficial session we just had there. With that said, I'm going to jump into our COVID updates. So overall, the trend is actually still continuing to decline slightly. It's gradually going down. We know that the severity of these COVID cases are not anywhere what we saw in the previous variants of times past. But with that said, we do still want to be cautious because we are now approaching the winter months, and we know it just turned into fall. And at least here in Delaware, once it turned to fall on 21st, the chill definitely came in the air. So summer left immediately, and fall is here to welcome us. So with that being said, we want to make sure everyone's still being cautious, and if they're in certain crowded areas, or if they're traveling for Thanksgiving coming up in November, or any other type of gatherings, definitely be cautious and use proper social distancing.
And after doing 2 already drive-through flu shot,
yes,
I think our patients are better prepared for what's coming.
Definitely, I'd agree.
And there are 2 more, I believe, right, in October?
They should be scheduled. And even if patients don't happen to get them with us, we just want to make sure everyone's getting the flu shot at some location. So, you know, it's better to get it somewhere than nowhere, but we do offer our location here. So for those who are able to get to make it in the area and get to us, that'd be great. With our COVID numbers, like I said, they're gradually going down. Mortality rate is still steadily low, so nothing too concerning there. And then also, along with COVID updates, we do include our monkeypox, which nationally that is also declining on a downward trend line. We do have a graph there with some visuals where you do see spikes, and I think those spikes on the daily average is for what built up over the weekend. So it looks like it's spread out roughly on a 7-day span. So where we see those couple of spikes throughout the graph, but overall the trend is going down. And we know Delaware, I think we have a range where the CDC is reporting roughly around, it's an estimate of between 35 and 50 cases or so. But with those mortality rates, even compared to COVID, monkeypox is way lower. So it's something to be keeping our eyes on, but concerning wise with mortality, it's not as severe as some of these other things we've seen.
So, and then also, I guess the vaccination for the monkeypox, person who's vaccinated versus not, the chances are 14 times more for the unvaccinated person to get infected. So,
yeah, better safe.
I wasn't vaccinated, and I don't know if I'm going to get that, but anyone who wants to get it, I think they did change the scope.
Okay.
There are more people who can actually now get it. So.
Yeah, I think originally they needed a blood work order from your doctor, but I'm wondering if it's becoming more available, more easily accessible.
So when, just going back to the COVID, by the way, I don't know how much you guys hear this, hopefully it's not a lot, but this side of the table is making a lot of noise. So the reason I'm kind of like on an eggshell is because I don't want to make a noise. So I do want to go back to the flu season, the winter. So it's all about preparation. And I'm going to keep saying this every week. Sometimes when I hear myself just saying these or hearing it from the different recordings, It may not be so much fun, but I think if we are able to reach out to different individuals every time we do these, that's part of the reason we are repeating perhaps. However, what's important, let's go back to the time before COVID. So many people forget that we used to have anywhere from 40,000 to 90,000 people. They would lose their lives in the United States, I believe only, this is just US only number. And it was just not recorded or we didn't pay attention. And many of these people were elderly, 65 and over. So I think what COVID actually, what we were able to learn from COVID was there are ways to actually protect ourselves. So I think for elderlies, if you are 65 and over, using a mask in public places is probably a good habit to keep. And I'm not saying that everyone should be masked all the time. No, I'm not saying that. But if you are at high risk, because you may get flu, and then we know that flu infection was a lot less during the COVID time because people were paying a lot more attention. So that's an important issue for elderlies to pay attention, and also get your flu shot because flu, I mean, I got mine last Friday, I believe, or last Thursday. Nothing happens. You don't have, a third arm or the fourth eye or you don't lose your ear. So it's a good thing. It's a good habit. It does protect to a degree. It doesn't actually eliminate the entire thing. So that's why we have to make sure that we prep for the winter season, and just to make sure that, especially again, the elderlies are in. I keep saying elderlies because I have both my parents, 71 and 81 years old, and I do tell them the same thing. So that's what we want. I want them to do, and same thing for our patients. That's what we want them to do. All right. So I'm gonna. Do we go to video number 3?
Yes, I did have just a couple of recent events. We have some global events and some U.S. economy updates and what's going on there that we can touch on. So whichever one you prefer to go to.
So I'm gonna open the. I was just joking earlier, but I wasn't really joking. I think we're gonna make a studio somewhere in this office because.
Podcast studio.
My days are becoming too
hectic.
Too hectic otherwise. So turning the office into a studio. So
yes. Sometimes we scramble right before, but we're able to get it done. But yeah, so, a little mini studio wouldn't hurt.
All right. So I have our video number 3 up. So we'll start with the global events. And again, why global events, why we are covering the global events, because the world is too small now. So everything that happens on the other side of
there's a ripple effect.
Yeah, it's affecting us here.
Yep.
So what do we have there?
Yeah, so some of the big news that's going on, as we know, we've been tracking in our sessions here, the conflict with the Russia-Ukraine war that was going on. And it seems like almost weekly we had some sort of update on whether it was regarding trade, supply, disruptions going on, more nuclear threats, whatever the case may be. But with this week, recently, we have, as of today, actually, Putin declaring and annexing areas of Ukraine now to claim it as Russian territory. And actually, earlier in the week, we also had the pipeline burst that was going from Germany to Russia. And they said that there was suspicions of sabotage, and we're not sure which side intentionally caused that. So
these are sensitive times, right? So things are going to happen, and then people are going to blame each other, or the countries are going to blame each other. Again, I think it definitely does make me nervous. I think the promoting the war is one big issue that I see in overall. So I think everything that can be resolved in the peace talks, and I know I have mentioned this before, and I think President Erdogan of Turkey is putting so much time and energy into this. But I also see how the other parties are not really just willing to resolve this issue. It's scary. Now, what else do we have from the?
So just another thing too, as we mentioned with these, the citizens are involved too. We know a lot of Russian citizens actually don't want war, and now that we're actually seeing these mass, like they're fleeing into neighboring countries to try to avoid being drafted or forced into this new mobilization that Putin was saying. So just to remind everyone the impact of these global events and what the ripple effect that it has trickles all the way down to people. Now you're seeing this big backups miles long of these borders where people are fleeing now as refugees from countries trying to avoid this conflict. So just to remind everyone, there is always the cause and effect, the domino effect, and people are impacted on their, they're fleeing their homes now. So,
So, the other thing that I was going to mention, a lot of people from Russia to Turkey, they're actually like traveling to escape from what's happening in their country. And I think almost all the hotels, which is not the season anymore in Turkey, so they're already full.
Wow.
So because that's where they're going to go. So it's an interesting time that we are going through, and now the nuclear war is not a joke. It may happen. I don't think anyone is prepped for that. So it's going to be a disaster if something like that happens.
I don't think you really can be. I mean, something of that magnitude, it's kind of hard to.
So, all right. Did we have anything else from the global side?
No, so that was kind of just the bigger highlights that were in the news regarding that conflict that we were tracking.
So last week we had the bariatric event, and Dr. Erkan actually was able to talk regarding the Tigray and Ethiopia issue. And again, they don't get much coverage for media, but what's happening there is a lot worse than what's happening in any other places right now. So almost 3.5 million people, they are displaced from where they live. Many of them don't have access. Don't know what we can, how we can actually fix all, and why it's happening from the beginning, right? So,
yeah, I think it'd be interesting if we were able to actually follow that conflict tracker that we had in some of our previous sessions and kind of get an update there to see what else may not be included in the news and what's actually relevant out there. So
we say conflict, but if you look back, Russia was in great terms with Germany. Just something like a couple of years ago, they had all these agreements and everything. They were doing trade, so they had no problems. They were in good terms with France, and all of a sudden now they don't love each other. So, I mean, this is not like Putin is just Putin. He didn't change, right? And then European countries were dealing with him just like any other countries, and now to blame Putin for everything, for their shortcomings, is not the right thing, because 2 years ago Putin versus today's Putin is no different. It's the same person, same everything he's doing same. They really needed to be more careful than what they were doing before, or now, like whichever it is, whichever is consistent, whichever is better for their country and for the people of their region. But as you know, these double standards, when who has the access to the media and then who can speak more, who can voice out their opinion better, not better necessarily, but more, just so that because they have more channels. And this is our voice, right? So this is how we are voicing out our opinion from our YouTube channel. So, so we'll go to the U.S. economy. So
as you get that prepped, just some of the things here with inflation and interest rates again still increasing, and across the U.S., we said this, I'm going to say months ago, following the pandemic, when we know everyone got the stimulus check, and how I think we mentioned how that impacted the people just spending it on like not needs, but wants. And it was like,
Mhm.
like you say, you can't have the cake and eat it too. And it was kind of just,
Okay.
they were living.
But
you know,
that doesn't apply. Like yesterday, Alp was in a meeting with me, and he was questioning something, saying that, why is this happening? I'm like, so I had to show him this reminder on my phone. So the common sense is not common practice. I keep reminding myself what that is. People, you deal with people who are going to look for these types of having my cake and eat it too approach, attitude. So we see this with not just with the economy, but we see it with our own network. Sometimes we see it with our patients, we see it with our employees, so families. This always happens. So there's selfishness, therefore not maybe projecting planning in a right way. So what you kind of just reminded us is that we've been telling people to understand what's coming to their way. And just because you have something doesn't mean that you're not going to pay. There will be always consequences.
Yeah, I agree. Yep, and as we see now, some of the slides here included have, the NASDAQ, S&P 500, Dow, and these are all roughly at least over 20%. I think one of them's at 18%, down 30% on the year to date. So the economy, with our stocks going, people holding on to the cash.
Let's talk about that a little bit. Actually, I need to find my notes, but somewhere here. Yeah. So right now the inflation is 8.3% as of August. So September number is going to come out. So what we have seen is the Feds, they are increasing the interest rates, and I believe it was February or March when we first talk about those issues. What happens when the interest rates are increased? Now, understanding why inflation is happening, right? So understanding the relationship between the interest rate and the inflation and the purchase power in terms of the value of our currency. So now we live in a country, and many people do actually, I believe they do follow, because I hear people talking about what we discuss, because sometimes they don't pay attention to the known facts, what these are. Like, for example, the US dollar is the reserve currency, right? So what that means is that it's actually a dominant reserve currency. This means not just us using the US dollar in the United States, but the entire world. In fact, it's about 60% of the world is using, countries are using US dollar to do their trade and then to do their work and get paid. So this is something that has happened after the World War II. And now that means when we have certain changes happening with our policy, with our economic policy, this has a full direct impact on other parts of the world. So many people don't understand that. So let's just put this in perspective. So, well, let's just use Turkey as an example. So about Turkey, so I'm always, now I have to be careful with calling it Turkey, which is supposed to be that anyway. But so if they have to buy some product from, let's say, from Mexico, but they pay that in US dollar. So that's the perspective that we want people to understand. So any other countries, 60%, this is what's happening. Now, of course, there are other currencies, reserve currencies. Euro is one of them, yen, pound, Canadian dollar. I didn't know that, even the Australian dollar, but they're small. So 60% is focusing on US dollar. So now let's take, because you mentioned the stock market, and let's take the inflation and the interest rates. And now we know that we want to control the inflation, but what it means to have inflation is important. Understanding where the inflation is coming from. So it may be just coming from the demand being increased, but the other thing that we keep you and I, we keep reminding people the 2 years is not going to be closed in any way that we know, right? So there is a production. Producers are not producing enough. So and when you have a shortage, automatically there will be an increase, and therefore you'll have inflation. Now, if U.S. dollar is too strong, people are going to say, well, what's wrong with that, right? So, well, there's a lot of things wrong with that, because as we are actually dealing with these other part of the global world, I guess we'll be able to purchase better, but they won't be able to afford certain things. So there will be, that means the production, there will be interruption to the supply chain. So because once we are too expensive, then you're not affordable anymore.
Exactly.
Right?
Yep. And then with that, even just mentioning like other currencies there, as the appreciation of the dollar is going up, comparably, the Japanese yen roughly down 20% on the year, and also we have the euro and the Thai that are both down more than 15%. So, as the US dollar is going up, these other currencies are decreasing. And we know in regards to the reserve, we looked into this a little bit, not too in depth, but with the special drawing rights, how it's the basket, kind of the compilation of the different currencies to try to balance out and see which nations are holding on to which of those SDRs.
So the other thing that we have to remember, our country, United States here, is based on consumption. So we consume a lot. But we don't consume the production, whatever we are consuming, we are not just generating them here. So we buy it from different parts of the country, the other countries. So once the currency is too strong, then those countries, them to do trade with us is going to be difficult. And therefore there will be a lack of goods and other things. So then this is going to actually create great recession. And that's one thing that people need to be careful. Now, the main point that we had was everything was okay from the currency side, and the interest rates are high, and people are we put a lot of money with increasing the interest rate. However, one important issue which you just mentioned, when you look at the stock market, that's anywhere from 22 to 40% down based on the platform they're in. And when stock is down, many people don't understand again. Well, you and I and Anne and John and Anna, we all play in the stock, not like actively, but we have our 401k, we may have our pension, we may have our IRA. So right now, whatever I had on my 401k last year is 30% down. So that's the part that we always come back to why we discuss these things in the healthcare news, is because if someone who retired at age 65, based on how much they have, not only they're actually struggling with the inflation, but their also savings went down from their 401k and then pension. So those are the important parts that we have to discuss.
And as you mentioned, for those people who then, once they do enter retirement, they're on a fixed income, and now you can draw less from this retirement if it's down 30%. Because a lot of those retirement plans will then reinvest any of the dividends that are made on those. You're gonna have to adjust your lifestyle with that, and then, like we said, the ripple effect down the road. Then all of a sudden, what are you cutting back on? Your food that you're buying, medications that you'd have to afford. So just remind everyone. Yep.
So, all right. Now, did we miss anything?
Let's see. No, we do have our upcoming events. I mean, for next week, we have Lieutenant Governor joining us.
Bethany Hall.
Correct.
She's going to be our guest. It's going to be a really fun conversation with her.
And one other thing I did forget to mention, just U.S. news, that we did have the hurricane that did hit Florida.
Yes.
So that is obviously going to disrupt a lot of things.
That's the other thing. A lot of elderlies who live in
a lot of people retire to Florida,
and a lot of them don't have flood policy on their home insurance. So And this is one of the biggest ones, right?
Oh yeah, there's super powerful wins, and it hit some record numbers across the board. And the fact that it's actually not completely in the clear yet. They know that some of the parts of the Carolinas and even all the way up to Virginia still have state of emergencies in case those high power winds do make their way back to the coast.
Yeah, so that's kind of sad. Now, in terms of our own events, so let's see. Well, actually, last Saturday, well, we miss you there. We had Brandywine Valley SPCA annual gala. Almost 400 people showed up. It was a really good event. One thing that we really do well in this country is these types of nonprofit organizations, and the amount of money that was raised was incredible. It was much better than what we projected. Everyone showed up, so it was great fun. So hopefully we'll do more of those events. And our animal hospital is about to be open, so we may have another session for that at some point. For all those who were there able to come and support, we thank them and appreciate their support. So that's all we have for today. So we do not have our Bariatric Friday. Dr. Erkan will be away for 2 Fridays. So our patients who are in the process, Rhoneise, Karen, and Patrick, so they are going through their process. So we'll have new updates from them by the time Dr. Erkan is back. So in the meantime, please stay safe, and thank you for watching us.
All right, thank you.